Hello, I'm Prof. Andreas Engelbrecht. I'm the Head of Emergency Medicine at Steve Biko Academic Hospital. I'm also with the University of Pretoria and I'm also with FPD.
Hi, I'm Dr. Vidya Lalu. I'm an emergency medicine specialist working at Steve Biko Academic Hospital and also with the University of Pretoria, as well as with the Foundation for Professional Development.
So Dr. Lalu and I have been with you through all these waves and developing some courses for the FPD on the management of COVID patients. It's been a long journey, exciting at times, difficult at times. And I think, we can just think back a little bit about how things have developed and how we have sort of developed some of the courses, maybe starting off with that course on the respiratory support of the COVID-19 patient.
Yeah, that was a steep learning curve for us all when we started sort of becoming familiar with COVID and how to deal with the aerosols that it generates. And we really came to understand that COVID is primarily a respiratory disease. Sure, there are complications, cardiac, neurological, otherwise, but the primary focus is really the respiratory tract. And that first course that we did, the respiratory support for COVID-19, that course really honed in on the skills of oxygen therapy. It had a nice progression, a stepwise approach of starting off with nasal cannula, adding on double oxygen, moving up to non-rebreather oxygen, using the rotisserie method for oxygenating awake patients. And then when the patients didn't respond to that, we stepped them up to non-invasive forms of ventilation like high-flow nasal cannula, non-invasive ventilations. And we went into the settings, how the machines work, the different nuances of operating those things. And then of course we went into intubation of the COVID patient with the many nuances, the extra steps, the negative pressure rooms, and then how to set the ventilator based on our patient's clinical scenario.
Yeah, intubation and ventilation always being sort of a last resort in COVID-19 and actually something we try to avoid. And then as time went on, the evidence started coming out, all the evidence about the vaccines, and that was part of the updates we did, the wonderful technology that was developed in terms of the excellent vaccines that we have now. Other evidence that came through the recovery trial and the big emphasis on the benefits that patients can get from steroids once they are oxygen dependent. So we took you through all that. And I think that's important. That made a huge difference to our hospitalized patients, a big difference in the mortality. And so there was quite a few courses that we did on covering, those aspects of the new evidence as it developed.
Yeah, and that leads us to where we are now, where we got to the fifth COVID wave, into the Omicron, where things changed a little bit, the patient presentation changed a little bit, and now we're focusing on retaining the skills that we have developed, because we don't know what is coming. We don't know how this fifth wave is going to manifest, so it's good to keep all those skills in our back pocket so we're prepared for anything.
I am going to tell you a little bit about our retaining COVID skills course and specifically concentrating on the home care aspect. Here we focus on not just the care for the patient itself, but also on the caregiver, how to prevent the caregiver from being infected, what are the safe ways to manage a patient at home. This includes symptomatic treatment, this includes the support structures you can offer the patient, filling the patient's prescriptions, how to ventilate the home so that the caregiver itself doesn't get infected. And then we also touch on that subject of the not so nice to talk about, but not that uncommon scenario where we have to do palliative care for certain patients. So we come across patients that have a lot of comorbid disease, who are elderly, who's not coping very well with their COVID. And sometimes the best care that we can offer them is palliative care. And that's also a component of home care that we go into on this course. So I encourage you all to attend this course and you'll be well informed about home care for COVID patients.
So the healthcare workers, kudos for still being involved in COVID and COVID education. I think there's a lot of COVID fatigue going around. Everybody's kind of over it. And I really hope that you found this insightful and that you're inspired to keep up with the evidence as we evolve evidence around long COVID particularly, and as we continue to learn. I think we as South Africans can also be proud in terms of how we've contributed to science, to the literature out there, and in how we've managed our patients. We've really balanced the kind of lack of resources with very large numbers of patients, and well done to everyone all round.